Today we're documenting the patient's blood glucose results on the acute diabetic record. Let's go ahead and write today's date. Let's say today is the 1st of October 2020 and the time is 8:30 in the morning. The patient does not require any diabetic medications at this time, so we can go ahead and draw a line through there. And the patient's blood glucose reading is 5.4. The lab portion does not apply to us. This is for when the patient's blood is taken through venipuncture. So we can just go ahead and write or draw a line on there and write our initials, SC, SPN for the designation. When we go to the second page, this portion here is intended for insulin injections, and therefore we will leave that blank for now. But when we get to where it says initials and signature, we want to make sure that we leave our imprint, basically. Go ahead and write your initial, your signature, and your designation. Okay, and that's how you would record a simple blood glucose documentation. Now let's say, for example, that our patient required an insulin injection. Let's go ahead and document that. Let's say today's date is the 2nd of October 2020 and the time is 8:30 in the morning and they received regular insulin. So let's go ahead and write the insulin name, Humulin R. This may vary based on where you work, the unit or the site, so just keep that in mind. Humulin R, 12 units. Remember to write the word unit or units in its entirety. Do not abbreviate subcutaneously. And the glucose meter reading or glucometer reading was 14. The lab portion does not apply. Go ahead and write our initial once again. Get to the second page. Let's say we administered this medication on the patient's right upper abdomen and we chose site number 1. So we can go ahead and mark that little area there, site number 1, upper right hand abdomen. And again, some facilities require that you highlight that site just for ease of viewing. All right, and then we have to record that on this side of the page over here. So let's look for upper right abdomen. So it's down here, or it's up here, I should say. Go ahead and indicate your initials. And today is the 2nd of October. And if you have not already done so, then you can go ahead and write your initials. But if this was the patient, for example, that you have taken care of before, then you don't need to continue to rewrite your initials and signature every single time. This is just a one-time deal. Okay, and that's how you would record on the acute diabetic record after the patient has received their insulin injection.